So I've just had a briefing from Dr Young and the Health Minister, and there's a couple of things we want to talk about today, and it's very important that Queenslanders listen to this message. So today I can say that we've had 2 new cases. One is a child, an overseas traveller in hotel quarantine. The second person is a cleaner from a hotel, which is one of our hotel quarantine places. So we have 20 active cases and we have had 15,000 tests over the last 24 hours, which is absolutely excellent news, and I thank Queenslanders for doing this. Now, this cleaner did everything right. She developed symptoms yesterday and was tested yesterday, and this is in addition to our regular testing that has happened, of course, with our cleaning staff in hotel quarantine. However, we need to ensure that there is no community spread, so we need to make sure that people in Brisbane are getting tested if they have any symptoms, and she lives in Algester, and we want the people in the following suburbs, if they have any symptoms whatsoever, to get tested. This will be Sunnybank Hills, Algester, Callumvale, and there will be more details that will be released. There's a lot of contact tracing that has been going on overnight, and I want to thank Health. Health are experts when it comes to this, and they are doing everything they can to alert the community. So we need the community to stay alert, and if anyone in your family has any symptoms, like Dr Young always says, we want that first point. So we want to make sure that we are getting that first person that has been positive. So please get tested. It's very important. So look, I'll hand over to Dr Young to talk a little bit more about that. Then she has to get to AHPPC, so please ask your questions to Dr Young after she speaks, and then we'll deal with other issues after that. The second thing I want to alert people to is in relation to travellers coming from Greater Sydney. You will not be allowed to come to Queensland. This will be reviewed at the end of the month. I know this is very disappointing for people during this time, but we are concerned still about Greater Sydney. We have a watching brief as well on Victoria. We are also very concerned about Victoria, and we'll be having a National Cabinet meeting tomorrow. I'll get further updates there, and I will update everyone after National Cabinet. But the key messages are, if you are sick, please go and get tested. We want all of our community to be safe in Queensland. Can I thank people for doing the right thing? I've seen a lot of cafes and restaurants making sure that they are checking in. You must keep up your social distancing, keep up that hand hygiene, and we'll get through this together. So once again, please, if you're sick, get tested, and the Health Minister will also run through our fever clinics up and running across the southeast, and Yvette will give a bit more detail about where people can get tested. We've ensured we've got adequate staff there, and we do want people to do the right thing. So I'll hand over to Dr Young.
Thank you very much, Premier. So 2 new cases in Queensland overnight. One, a young child who's recently travelled from the UK and has tested positive in hotel quarantine. The second is a lady who works as a cleaner at the Hotel Grand Chancellor, and she has been fantastic. So she got tested as part of our routine weekly, every 7-day testing on the 29th of December, and was negative. Then she since then developed symptoms, so came forward to get tested, and we got that result late last night, and it's positive. So we've been working with her through the night, and she has been fantastic and has cooperated fully with us. So we've been working through with her where she has been during her infectious period. So we have deemed her infectious period to be from the 2nd of January onwards. She did 1 one shift at the Grand Chancellor on the 2nd of January, so we've been working with the hotel, who have been very, very helpful with anyone who's been in that hotel to just ensure that we've covered all bases there in terms of anyone she's come into contact. And we've then spoken to her about where else she has been in the community since then. And I want to go through those sites now in detail, but I stress this is just the first information. We are likely, as we continue to talk to her and her family and household, we will get other sites, so it is really important that people keep alert who are in Brisbane at the moment as to other sites that could be a concern. So these sites are places that the lady has been while infectious, so it's important that people, if they have any symptoms at all, come forward and get tested. Now, her close contacts we will be talking to directly, and we will be asking them to come forward and get tested whether or not they have symptoms and to quarantine. But these other sites, we really want people to be alert to themselves. Any symptoms, it is really, really important that people come forward. So these are the sites we're aware of so far. The lady caught a train from Old Tandy Station to Roma Street at 7 a.m. on Saturday, the 2nd of January, and we're working with Transport to get go-card information, CCTV and so forth, and so we will get that. But in the meantime, please, anyone who is on that train or at Old Tandy Station or Roma Street around that time, any symptoms at all, please come forward and get tested. Similarly, she caught a train at 4 p.m. from Central Station to Old Tandy Station on Saturday, the 2nd of January, so before and after her shift working that day. Plus, anyone who might have been working in that part of the city, any symptoms at all, come forward and get tested. Then Woolworths, Callum North, from 11 a.m. to 12 noon on Sunday, the 3rd of January. So that's the Callum Central Shopping Centre. So that area there, but anyone who's been to that Callum North Shopping Centre, please, Callum Central Shopping Centre with the Callum North Wars, please come forward. Similarly, Coles, Sunnybank Hills from 7:30 a.m. to 8 a.m. on Tuesday, the 5th of January, another site that I'm concerned about. Then the last site is the newsagent at Sunnybank Hills Shopping Town from 8 to 8:15 a.m. on Tuesday, the 5th of January. So that's the newsagent that's located at the corner of Callum and Compton Road in Sunnybank Hills. So that as well. But this is the time. Anyone with any symptoms anywhere in Brisbane, it is really critical that you come forward and get tested. If you don't have symptoms, just keep alert. For if you do develop any, come forward. We will directly be contacting those people without symptoms who we want to have tested. So other people, it's if you've got any symptoms, that's critical. We are standing up more testing clinics, and they'll be available on our website so people can see the hours that they're open. And we're also working, and I'm very grateful, with the private sector, with SNP and QML for them to stand up additional hours, additional clinics, particularly in that South Brisbane area around Algester, Sunnybank Hills, Callum Vale, that area. But this is very important just because, as I've always said, I want to find these cases right at the start of an outbreak, not down the track, because if we find them now, today, then we can stop the outbreak spreading and we don't need to put any restrictions in place. Thank you. I'm very happy to take any questions.
How old is the child?
In their 0 to 9, in that age group.
Do you know if this latest community case, is that related to the UK strain?
We don't know. So, of course, we're doing urgent whole genome sequencing as we speak, and we should get that in the next 24, 48 hours.
Have there been any other cases in that particular hotel that you know of at this stage?
Yes, there's been 4 other cases in the last period in that hotel.
Is this woman, does she work anywhere else besides the hotel?
She's a casual worker and we don't believe so, but we're just double checking that.
Dr. Young, is it weekly testing for quarantine workers?
Yes, yes. So we've asked anyone who has contact with any of the people who are quarantined in the hotels, or they're a cleaner, because of course they've then got contact with those rooms, to get tested every 7 days.
Dr. Young, when was New South Wales' last unlinked case, and what would you need to see in Greater Sydney to reopen for?
Right, they've been having a number of unlinked cases. They often then find the linkage, so there has been quite a few over the last week.
And what would you need to see in Greater Sydney to reopen for?
28 days of no unlinked cases.
Just off the back of this case, does the government or Queensland Health have a closer look at the processes in place for workers at hotel quarantine sites?
Yes, we do that all the time. So we're reviewing all of our processes in all of our hotels on a regular basis. But there is no suggestion that this young woman has done anything wrong. We know that this is a very infectious virus and we know that it can escape. It's done that in multiple other sites around the country.
Are there any areas that you believe can be strengthened in the current process?
There is one, so we've put it in place. Starting Monday, I would like every single one of these people to be tested every shift, not just every 7 days. So I think 7 days was a very good start and we started that process. I think now we need to move to every shift.
When someone gets diagnosed or in hotel quarantine, they immediately get moved to hospital. Is that the case for this woman as well?
Yes, I don't know that she's yet made it into hospital, but we'll work that through between her and the clinicians.
Have there been renewed discussions with Cricket Australia about the Indian cricket team playing for the Gabba?
Not renewed. We've had ongoing discussions with Cricket Australia and they've been very, very productive, and I understand that's all in place.
The Indian Cricket Board has written to the Australian Cricket Board about not wanting to play because they'll have to quarantine. Do you have a message for the Indian?
That's something between Cricket Australia and the Indian Cricket Board for them to work through.
They are responding though to your rules. Will you be budging on any of them?
No, my rules are the standard rules I've used for sporting teams right from the start, and they've worked very successfully for us, so that's what we'll continue to do.
Do you believe the test should go ahead at 100% capacity given this latest case?
It's too early to make any comment on that. We've had one case. Let's go and do a lot of testing out there, which I'm very sure will happen. Queenslanders have always responded very, very well whenever I've asked for increased testing. Let's do that increased testing and see whether there's been any spread before making any decisions. It's not till the 15th of January, that match.
Dr. Young, do you know how long this young woman was infectious in the community for?
Yes, so we've deemed that she was infectious on the 2nd and today's the 7th.
We saw the first green flight from New Zealand this morning. Is this the right time to have international arrivals?
We've got a lot of international arrivals. We accept over 1,000 per week and we put them into hotel quarantine.
Without hotel quarantine, I mean.
They're green flights. They're perfectly safe. We have not seen any community transmission in New Zealand now for well over a month, and so it is perfectly safe for them to come in. They don't have community transmission. They're green flights, which means all of the crew have only worked on those green flights.
Dr. Young, in this latest case, this would be considered a case of community transmission?
Yes, it would.
And just with the 4 cases at the Grand Chancellor, were any of those the 3 cases, the 2 cases of the UK, or 1 case of the UK strain and the 2 of the South African strain?
Yes, one of them is definitely the UK strain.
Do you believe that flights from the UK should be stopped given the particularly virulent strain over there?
Unfortunately, that strain has now spread throughout the world, so it wouldn't be an issue of just stopping flights from the UK.
What's your position going into the meeting today? Is there anything that you're taking into the meeting today?
Into AHPPC, we've discussed and we will continue to discuss on a regular basis. We meet every single day, so we discuss what's going on in each jurisdiction, so we have full understanding, so we can make decisions for our own jurisdiction based on that advice. So that's the main function each day. Then we also discuss various other issues to provide advice through to National Cabinet, and then National Cabinet discusses them.
Dr. Young, the Qantas have said they're looking at starting flights again mid-year. Do you think that's a little bit early given what's happening in Australia at the moment?
I think business always pre-prepares for anything. Just because they're preparing to do things doesn't necessarily mean it will happen, but if you don't prepare, then it can't happen. So I would support any business that is prepared for the next phase of where we go with this pandemic.
Would you like to see cruises come back? Do you think that can be done in a safe way?
Well, so far I've seen overseas they have trialled cruises in many different locations, and each time they've had outbreaks of COVID from what I've seen. So I think there needs to be a lot more work before cruises, large cruises, can safely come back.
Dr. Young, do you know the age of the clinic?
She's in her 20s.
Premier,
All right, I might just let Dr Young go to HCBC, and I'll let her vet, and then I'm happy to.
Thank you. Well, firstly, we want to thank Queenslanders who have done an incredibly great job in containing this virus in our community for 113 days. Sadly, today we do have a locally acquired case, and what that means is we want Queenslanders to step up once again, come out and be tested if you have any symptoms, particularly in the areas that we've talked about, Sunnybank, Callum Vale, Algester, but also Brisbane as well. But of course, this message is across Queensland. If you have any symptoms, you should go get tested. We are making sure that we have extra testing available, particularly in the Sunnybank, Algester and Callum Vale areas. We will make sure that we have extended hours across our public sites, but in addition, we have reached out already this morning to some of the private providers who are now offering testing without requiring a referral from a GP. So we encourage people to go onto the Queensland Health website to have a look at where the clinics are and the hours of those clinics. We have spoken to private providers as well about opening for additional hours over the weekend, because we want to make sure that if anyone has any symptoms over the weekend, they are coming out and getting tested. So not just looking at the public sites, but we also encourage people to have a look at the private sites that are open over the coming days where they don't require a referral, and go get tested. Because it is important that we have as many people coming out and getting tested as possible to make sure that we don't have transmission in the community. We also ask Queenslanders, particularly those in those areas we've mentioned, to keep a regular look at the website. The sites we are mentioning today are just the start. We are continuing to have conversations with the woman who is positive to see where else she may have been, and we will update those sites, and of course with those close contacts as well. So the close contacts will be contacted, asked to be tested and go into quarantine, but anyone else who's been to those sites or anyone across Brisbane who have any symptoms should come out and get tested. So check the website. If you're not sure on the website or you're unable to look at the website, ring up 13 Health. You can ring up 13 Health and ask where your local clinics are and the hours of those clinics. But we will have clinics across the Browns Plains, Algester, Sunnybank, Hills and Callum Vale area, and of course Brisbane, anyone who has been on those trains that have been mentioned on that Saturday. As we stated, the woman in question was infectious from the 2nd of January and got tested on the 6th. So she's been out in the community from the 2nd to the 6th before she became aware of being positive. So we are asking people who have been around Brisbane over that time to go out and get tested. Happy to take any questions.
Like you said before, do you know how many close contacts there are that have been?
Not at this stage. That work is still ongoing, talking to the woman to find out how many contacts there are. We have to remember when we're talking about public transport, when we're talking about shopping centres and ATMs, we're not recording people's details at those sites. So it's really important that anyone who visits those areas or lives in those areas to check this site and if they have been to these venues and these sites over that period, to immediately come out and get tested, because it won't be that we have a public register for those particular sites. So we are requiring the public to come forward and to help us by going and getting tested.
Would you like them, sorry, so would you like them to get tested even if they're not showing symptoms at this stage in those areas?
So only the people who have been traced, so there will be individuals who will be directly contacted. Those people who have been to these sites, what we are asking for is for you, if you've been in these sites for this particular time, we do encourage you to come forward, but particularly asking people if you have any symptoms whatsoever. If you've visited these shopping centres, if you've been on these trains at these times, or at these ATMs or the newsagents, please, if you have any symptoms whatsoever, come forward. But that message is for the broader public as well, but particularly those who have been to these sites over this time.
Is there a concern about aged care places in those areas at the moment?
So we don't have any evidence that the individual has been to any aged care facilities, but once we do the contact tracing, we will take advice from Dr Young as to whether we need to take any further action. And of course, as the Premier has said, we are now extending our restrictions in relation to hotspots for New South Wales from the 8th of January to the end of the month. This is about providing certainty for tourism as well. We know that tourism operators will have bookings after the 8th of January and before the end of January for people from those hotspots, and obviously their plans will now need to change. And if there are cancellations, our message is the same. For people in Queensland, from border areas, regional New South Wales and elsewhere, you're welcome to come to Queensland and holiday, and please be checking these sites and making sure we're supporting our tourism operators over this difficult time. But we are needing to extend these restrictions on hotspots until the end of the month, which it will be reviewed then.
Minister, I'm sorry if you've mentioned this, but has that cleaner been interstate in the last month, or has she just been working?
We're not aware that that person has been interstate. The likelihood is this person has got it from the hotel, but we are doing that sequencing right now. We hope to have that information in the next 24 hours.
When will the shift-by-shift testing regime begin?
On Monday. So we have been testing every 7 days, and this individual, this worker, did get tested on the 29th of December and had a negative test. So we know that they've been positive since then. They first showed signs on the 4th, which means they were infected from, or infectious from the 2nd of January.
Are there any other processes in the hotel quarantine scheme here in Queensland that you think needs to be reviewed or looked at in following this case?
Certainly when you get one of these cases, and thankfully we haven't had one of these cases previously, we will immediately review all of the practices, the movements of this individual, any contact this individual had with any of the positive cases, or of any of the rooms in which the positive cases were moved out into hospital. So we will review all of those processes to see if there is any more we can do to improve on our processes. And of course, as you would all be aware, we're having discussions, and I'm sure National Cabinet will be discussing tomorrow the issue of testing of individuals before they get on planes, and also mask wearing. There's a number of states and health ministers we've been having discussions over the last 24, 48 hours about people wearing masks on domestic flights. And we have asked the federal government to be looking at those things as well. So, but of course we encourage people to continue to wear masks, but we do need to look at particularly people arriving from overseas, those international flights, what else we can be doing to stop the infection coming to our shores.
Minister, there's been a rise in detections in our sewage system. The Algesta area or Sunnybank area where that services, is that one of those testing sites?
I would need to go back and see if that is one of the sites, but having said that, we know the positive cases that were at the Grand Chancellor, so we'd have positive sewage in Brisbane City Council area. That's why we don't test, because that's where our hotel quarantine areas are, and we know we'd get positive sewage. We will go back and have a look at that and see whether there's any positive that has shown up. But again, that could be simply from people who are still shedding from past positive cases. But of any of the areas we have announced, over Queensland where there's been positive sewage, we do ask people to come forward and get tested as well if they've got any symptoms whatsoever. Thanks.
So, Jack, just in response to your question too, the federal government did a review through National Cabinet of hotel quarantine. So that was done nationally, and all of the states were making sure that they had strict measures in place. As I've always said, you need to continue to have those strict measures in place, and as Dr Young said, this woman has done everything correctly. So once again, let's urge Queenslanders, especially in those areas, if they have any symptoms, please come and get tested. We've set up those fever clinics. They're there ready for you to come and get tested. And if we all do that as a community, we are looking after one another. Also too, Dr Young stressed to me too, if I could convey, if people are thinking about travelling into New South Wales and Victoria, if you are Queenslanders, to please reconsider that travel. Now is a good time to stay at home.
Premier, 3 people were given written notices for making false border declarations and another for home quarantining on the Sunshine Coast. How disappointing is it to see people still violating the health advice this far into the
Yeah, well, that of course is very disappointing because people do need to do the right thing. Okay.
Are you concerned that the Brisbane test might not go ahead at the Gabba?
Look, my understanding is that all of the conversations that are happening are very positive. So I don't have any concerns at the moment.
Have you heard that the Indian Cricket Board wrote to the Australian Cricket Board saying they weren't happy?
Yeah, and as Dr Young said, that's a matter between the Indian cricket team and Cricket Australia, but from our point of view, the same measures that have been put in place where we successfully have hosted a number of events, including the AFL, I think have stood Queensland in good stead. So the rules still apply and the conversations are still happening.
So you're not doing anything differently to
No.
are you?
No. Not to my knowledge, no, but you know, we need to make sure that everything is safe. This is about making sure Queensland is safe, and if Dr Young has put in place specific rules, then they need to be abided by. So there'll be the same rules that applied, from my understanding, from the AFL and the basketball.
You've previously raised concerns about the hotel quarantine scheme all across the country. Can Queenslanders be confident that Queensland is coping at the moment with that current COVID?
Absolutely, and that is why we have made sure that we have not succumbed to any pressure to increase our number of arrivals. We have done it in a measured and responsible manner to what Queensland can cope with. But I think what we need to be aware of, and all Queenslanders need to be aware of this, is the fact that in the Northern Hemisphere we are seeing widespread transmission of COVID. The UK, my understanding is currently in lockdown till around mid-February. So, of course, there is concern across the Northern Hemisphere, which means we have to be even more on our guard. I'm very pleased that National Cabinet is meeting tomorrow. I look forward to the discussions that will happen there, and I'm happy to update you following that meeting.
Are you going to take anything specifically to that cabinet meeting?
What I would like to see is, I think I'd like to see a bit more federal cooperation with the states with quarantine. I think that would be good. We do have the ADF, my understanding is supporting when the planes come in, but maybe we do need to increase that cooperation. So I will be raising that.
How do you mean, like, more? What do you mean by more cooperation?
Well, I just think that we need to have more cooperation, federal and state, working together with this hotel quarantine, because it's about international travellers coming home to Australia. So I think there needs to be even more cooperation, and I thank the federal government for the cooperation they have shown us to date. Okay.
There were 2, just quickly for our regional team, there were 2 boys killed from emerald down in New South Wales.
Heartbreaking. I just I read that this morning, and absolutely heartbreaking. And our condolences go to the parents on the tragic loss of the 2 young boys, 2 brothers. Okay. Thanks everyone. See you tomorrow.